Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's learn about consultation EM coding. So first we'll understand what is consultation coding and also we'll see the type of consultation, that is outpatient consultation and inpatient or observation consultation. And also we are going to see the coding guideline and the document requirement to consider it as a consultation coding. And lastly, I have added few practice questions. So let's first understand what is consultation coding. So consultation is a type of evaluation and management service provided at the request of another physician or qualified health professional. So in simple way, one doctor should request one more doctor to see his patient. Okay, to see his patient and to review his patient health condition or a medical record and to furnish us the service which is necessary, and also if any abnormalities are found, and he can just write a report back to the initial provider. Okay, this is how consultation works. So diagnostic and therapeutic services can be initiated during the consultation. So the other doctor who are accepted to perform the services, he can initiate diagnostic or a therapeutic service in order to treat the patient. And also communication of finding is mandatory via written report. So the other doctor is nothing but the consultant. If he find out any abnormalities in the patient's medical record or patient's report, he can write a report back to the initial provider. And make sure consultation requested by patient or a family are not coded as consultations. Okay, if in the whole scenario, if you somewhere you are seeing like consultation was requested by patient or patient father, mother, okay, any one of his family member, then that is directly you cannot take it as a consultation coding. Instead, you can code it as either ENM OP coding or IP coding, okay, based on the place of service. So here, what you have to check, you need to check these three are okay to consider it is a consultation visit or not. So the first thing is physician should request the other physician, and the other physician should accept, and he should review the patient. Okay, review and he can render the service which is necessary. And lastly, whatever the services he has provided and what are the abnormalities he has found out, that the other doctor needs to write a written report and he needs to send back to the initial provider. Okay, so if the three R's are met in the scenario, you can go ahead and consider it as a consultation visit. So this is all about understanding consultation. So next we'll see a place of service based on consultation. So first place of service is office or other outpatient consultations. So you can see here new or established patient. So we don't have to check whether patient is new or established. Here you need to check the consultation was initiated by an outpatient physician or an inpatient doctor. Okay, this is what you have to check. So outpatient code starting from 99242, 243, 244 and 245. And coding guidelines are there, like we follow both MDM guideline and time based coding for consultation. So setting can be office or home, residence or emergency department. All of this will be coming under outpatient setting only. And follow up visit. So if consultation is a follow up, then use an appropriate code for an established patients. And service consulting to transfer care are not coded as consultation. So if services are constituting to transfer, if they decide to transfer, then we will not be able to code it as a consultation visit. So next, coming to inpatient or observation consultation. So the code starting from 99252, 253, 254 and 255. Here also you don't need to check whether patient is new or established. Okay. So because we don't have any differentiation codes between new and established, here you need to check consultation performed at which setting, inpatient or outpatient. Next, hospital inpatient settings include for IP, what are the services? You can conclude it as a IP consultation. So if it takes in hospital inpatient or observation level or resident of nursing facility or partial hospital settings, all of this can be contribute towards inpatient care. And what is the requirement? Face to face professional service from a different specialty or subspecialty during the stay. And only one consultation per specialty is allowed. Okay, you cannot code multiple consultations. For one day we are supposed to code only one consultation visit. And whoever works under the same specialty, that like physician partners, nurse, okay, all of those will be considered as subspecialty. So coming to coding guideline for consultation coding. So as earlier I said, request documentation must be requested by qualified healthcare professional. Okay, only one physician should request another physician, then only you can consider it as a consultation visit. If patient or family members are requesting, means we cannot take it as a consultation visit. Okay, and report requirement. So consultant's opinion and service must be shared with the requesting professional. So that is what, if the other doctor accepted the physician request and the other doctor is performing any services and any kind of abnormalities he has found out, he need to write a report back to the initial requested physician. Okay, so as I explained, 3 R's should be met. And we have one modifier usage. Use modifier 32 for mandated consultations. So mandated means if consultation is initiated by third party payer. Okay, third party sometimes it includes like for crime cases or forensic cases, if court or any other like maybe a insurer, if they are asking to consult or to initiate the consultation, then we go with the modifier 32 along with the consultation code. Then for prolonged service, so as I said, here consultation we follow both MDM guideline and time based coding. So when you are coding based on time, if you meet a prolonged service, okay, you need to use 99417 and 418 add-on codes according to the place of service. If you are meeting an exceed time in the outpatient setting, we will use 99417, and if we have exceed timing in inpatient setting, we will use add-on code 99418 along with the highest ENM level. And lastly, admission scenarios are reported under initial hospital inpatient or observation care codes. So if same day patient is getting admitted to the hospital, means we have to go with the IP services. So now we will see a few practice questions, and I have added the code set. So please just have a look. Coming to question, a primary care physician refers a 50-year-old patient to the cardiologist for evaluation of chest pain. The cardiologist performs history comprehensive, exam detailed, and MDM moderate complexity, and also the cardiologist provides a written report back to the referring physician. Okay, so first identify where this consultation was initiated. So who initiated the consultation? Primary care physician. That means primary care physician means it's an outpatient setting, and cardiologist will be a consultant, like is another doctor, and he agreed and he also performed a comprehensive history detailed exam, and he provided MDM of moderate complexity, and then the cardiologist also provide the written report. So all the three are being met. Okay, so now we know this is an actual consultation visit. So just see the options 99242, 243, 244 and 245, and here we don't have any time specification in the question, so we are going with the MDM coding guideline. So moderate MDM they have already given, so moderate MDM code would be 99244. Okay, So answer should be 99244, answer C. So easy. So all you have to check is, the first thing, check for the request, who initiated the request, and check whether the consultant or other doctor is accepted the request or not. And if we accept the request, what kind of service he has given, and is the report is like the other consultant is given the report back or not. So these things we need to check, and we can code easily. An IP orthopedic surgeon is called to consult on a 70-year-old patient with a severe back pain, and the physician performs history of expanded problem focused, exam detailed, MDM with high complexity. The consultant provides a report to the requesting physician. Okay, so there is a report and there is also a request, and that consultant provided the service of MDM high complexity. So see the options 99252, 254, 53 and 55. So firstly make sure which setting it is. So it's IP setting. Okay, consultation is it belongs to IP consultation, and MDM is high MDM. So according to the MDM guideline, we will get code 99255. Answer is D. Okay, so it's an IP consultation visit. So next, so one more question we have based on time coding guideline. So here again, a rheumatologist consulted by a primary care physician to evaluate 60-year-old patient with a rheumatoid arthritis. The primary care physician requests the rheumatologist expertise regarding disease management. During the consultation, a rheumatologist spends 75 minutes face to face with the patient and caregiver, discussing the following: disease management strategies, risk and benefit of new medication, and lifestyle modification to improve the symptoms. So what is the ENM code is reported for the consultation visit. So you can see the total time he has spent is 75 minutes. So according to our time guideline, 75 minutes you are getting here. So, and again it's a consulted by primary care physician. So it's an outpatient consultation visit, and if you see the time 75, so option 99242 is only 20 to 29 minutes, 99243 is 30 to 39 minutes, 99245 is 44 to 55 minutes. And we know that we have like exceeding the time limit, so we have to go and take the prolonged service code. So according to that, we will utilize 99245 and 99417 for additional extra 15 minutes. Okay, so totally we have how much minutes extra? We have almost 20 minutes extra, but we are coding only one unit because we are getting only one 15 minutes increment. Okay, so 99245 and 99417 we can code. So all since it's outpatient, we are utilizing 99417. If it was inpatient setting, we would have taken 99418. Okay, in previous videos I have explained all the prolonged service codes. So if you have doubts, please go back and check. And here most of the time consultation codings only guidelines they will ask, and if they are asking the real-time question, follow these particular coding guidelines, like check for the request, who is requesting consultation, and whether that consultant provider is giving the service and giving the report. Okay, all of these things please check and you can code it. So that's all for today, and it was a simple topic. And if any doubts, please comment so that I can tell you what is the correct thing. Okay, That's all guys. Thank you all. Thank you for watching.